Hello and welcome to this video demonstration of a Femto LASIK procedure. This is Dr. Wissam Ahmed from Cairo, Egypt, and this is a real-time video of the procedure. This video is intended to be watched by ophthalmologists who are starting their Femto career, and I hope I can provide some nice tips to guide you to have a smooth and successful surgery. This is the view from the beautiful Femto LASIK cone. I'm using the FS200 machine, and we are starting now with the right eye. Now I am bringing the right eye up, and as you can see, the two red dots are supposed to be overlapping for the view to be in focus, and I am slightly defocusing the view for the two red dots to be about at the limbus for the corneal plane to come in focus when the cone applanates the cornea. I am now starting with the right eye, and after taping the lids and lashes, inserting the speculum to keep the eye opened, it's very useful to tilt the head a bit to the left side to have a good exposure. I'm now drying the surface of the cornea and conjunctiva in order to have a good grip when I insert the suction tube. Here it is. I let it rest on the surface of the eye. I get a clear view of the sclera all around, and then I press down, and also I press the foot pedal for the suction. The machine tells me that the suction is on. And now with the docking. I am taking my time to guide the femto cone inside the suction tube. Some micro adjustments of the head, and wait for the confirmation of the machine to tell me that suction 2 is on. Now I will start to shoot the laser with the foot pedal. Here it is. And as you can see, the machine is creating the bed first and then the side cuts. It's essential to know this piece of information because the side cuts are created in the last about 5% of the laser time. So if you just pulled your foot prematurely, the side cuts would have not been constructed properly, and you will have a very hard time lifting the flap. At that time, you will be supporting the patient's head with your two hands and keep focusing your eyes on the progression of the laser time till you see the 100% sign, and spend 1 or 2 more seconds before you lift your foot up the pedal to ensure that it's completely done. And now we will shift to the left eye. My nurse is now draping the left eye, taping the lids and lashes, and inserting the speculum, instilling some more corneal anesthetic drops. It's very important to keep communicating with the patient, encouraging them, and keep your tone as calm and as supportive as possible. The same steps are repeated here. Now in the left eye, a bit of a tilt to the right and a slight defocus. Some patients may have some conjunctival folds, and it's very useful to just push these away towards the lids in the process of drying the surface. Now the same here, I'll let the suction tube just rest first, and it's very important as well to tell the patient that they will lose sight completely during the next few seconds. Instructing the patient not to move at all, not even to move their feet or hands, just to sit still, keep both their eyes opened. Now with the docking, sometimes I get a little help from my optician in moving the head a bit to the right or to the left, because the whole eye might be a bit tilted until I get the confirmation from the machine that I can proceed and the suction is on, taking the few extra seconds more, pressing the pedal to ensure that the bed and the side cuts are constructed properly, and we are done with the femto stage. Now the patient's bed will swing to the excimer laser machine. Now I'm telling the patient that there is a little green light in the middle of the view, and to keep focusing on that light all the time, I always tell them to open both eyes together and not to try to close their eyes forcibly, because usually when that happens, the Bell's phenomenon kicks in and the eye will be lifted up. I use a blunt-tipped instrument, and I start about 1 or 2 millimeters near the hinge of the flap. I start by just pointing the tip down towards the stroma, and dissecting my way through a bit by bit, because the femto flap is very sticky. So I take my time to go in and down many times, or as many times as it takes, to ensure that the flap is totally dissected. This is a very gentle technique, very gentle on the hinge of the flap itself. I revert the flap all the way back and ensure I have very good exposure near the hinge. I take a sponge and I dry the bed of the stroma, calm down the patient, and letting them know that it's okay now to have a distorted view of the green light. It's diffuse, and telling them to just look at the center of the green light. I am focusing my laser and I am ensuring that the eye tracker is working fine to compensate for any micro movements. I take the sponge and I protect the edge of the flap against any ablation of that area, because this will induce higher order aberrations. And voila, the excimer laser is done. I put a drop of BSS on the bed and just a drop on the flap itself. I go under it and I revert it back to its place. I wash the interface to wash out any debris underneath the flap, and these little drops gives me a better view of what's underneath and what's above the flap. And if I see any particles, I just go in again and wash them out. I usually dry the surface with a sponge and kindly notice the white glow that will appear now in the gutter between the flap and the stroma. This little white glow is called the Fawzi sign. Professor Dr. Fathi Fawzi registered this sign with his name in the American Academy Convention in 2016. And this ensures a perfect realignment of the flap. This is the microcapillarity effect, and this is the look of the dry gutter when I insert the sponge. It sucks out all the water, and this white glow is the dry gutter appearing. I massage the upper lid over the cornea 2 to 3 times to ensure that the flap is in place and not moving. Ensure that the endothelial pump began working, sucking back the flap to its place. And now I switch to the left eye. The exact same steps are followed here. I go in with my blunt-tipped instrument near the hinge, go in for a few millimeters, and then down, in and down, little by little, because sometimes the flaps are extremely sticky and they take maybe about a minute to get a smooth dissection. I revert the flap all the way back. Sometimes I revert it back on itself if there is no enough space. Ensure a good exposure, focusing the lights, drying off the corneal bed, ensuring that the eye tracker is working properly. Checking that the laser is ready. Two dots are perfectly overlapped. Centering as much as possible. Protecting the hinge. And now I am shooting the laser, watching the eye. For if the patient made any vigorous movements, I can stop and continue again. Wetting the bed and the flap itself before reverting it back to its place. Just few drops. And here it is. I am washing the interface. And again, these few drops gives you a clear view of any debris underneath the flap. Kindly watch again for the Fauci sign, the white glow that will appear in the gutter between the flap and the rest of the cornea. Here it is. This shows the supremacy of the femto constructed flaps. This does not happen in the regular microkeratome LASIK. This patient did extremely well post-op, attaining a vision of 1.5 unaided in each eye. Thank you so much for watching. I hope you learned something in this video. Kindly send me any comments or questions on my email. Thank you. This is Dr. Wissam Ahmed from Cairo, Egypt.